So, President Cyril Ramaphosa will address the nation at 8 p.m. this evening on efforts the country is taking to fight COVID-19. His address follows a National Coronavirus Command Council meeting. South Africa has entered the third wave of the COVID-19 pandemic with well over 8,000 new infections being reported per day. The Ministerial Advisory Committee on COVID-19 has expressed concern about these numbers, calling for action from government. Acting Health Minister Mmamoloko Kubayi-Ngubane, during her visit to Bara Hospital in Soweto over the weekend, said they were looking at imposing further restrictions on provinces like Gauteng, the Free State and the Northern Cape. Political analyst Ongama Mtimka joins me now. Very good evening to you, Ongama. Thank you so much for speaking to us. So let me just first start with that last sentence. Localized, tougher restrictions. How possible is that? And I recall a conversation just a few days ago with Professor Salim, who was saying that actually in the past we've considered this, but it just wouldn't work because you're just going to have to keep on shifting these restrictions if you're going to localize them. What are your thoughts on that?
Well, the president did set a precedent in December last year, which kind of showed this segmented approach when it comes to managing COVID-19 and ensuring that what were regarded as hotspots had a different lockdown level compared to the rest of the country where there wasn't. Obviously, that needed subsequent revisions in terms of how it was applied. But I think that when you consider the fact that COVID-19 is not just a public health crisis, it's also a social and economic crisis. And this being an election year has got some political, aspects to it. So it's important that when measures are being considered, the approach which the president has had before of being consultative and finding ways in which, consequences that are unintended can be managed is still important. One of the things, for example, in addition to your question around locally nuanced or segmented strategies, is the whole question of how, for example, categories of things have been grouped and uncritically. So, for example, where you find that gatherings is a broad term that refers to instances where people gather when they are sober and in a controlled environment, to being in instances where people gather in very much uncontrolled environments and in fact not in a sober state. So that in recent weeks has taken some criticism, especially from the faith-based communities who feel that gatherings in spaces where people are not in fact losing control and they're strictly managed shouldn't be treated the same way.
So let's talk about those nuances that you raised, Ongama. Speaking of sobriety, one, there's the fact that hospital admissions have gone up and there's a shortage of hospital beds. And we know that in the past, it's been reported that when you cut off the sales of alcohol, that reduces pressure on the systems, public healthcare system. And another issue is, you mentioned the localized restrictions were due to a careful consideration. Scientists have discovered, I believe, a recently detected potentially dangerous coronavirus mutation. So then it was because of a variant. So how hard will this press the president's hand to make a firm decision?
Well, it's going to be, here's an issue when it comes to what we're learning about what's available to policymakers with COVID-19. You cannot afford to take society for granted that whatever actions you take which set precedents are not going to be looked down upon when you act in a way that's inconsistent with that precedence. So, for example, what government did one time was to close going to beaches in hotspots areas and still permit it in other areas. which showed that the assumptions that were made about what likely happens in beaches were in fact inconsistent. So or it gave the impression, by not actually having the same policy stance and actually acceding to lobbying by different provinces, it creates that inconsistency, which then opens up the policy choice to criticism. And that criticism actually is fair. So it's important that when the government takes actions, it is highly backed by data around what assumptions are happening. And also, Tsapiso, it's important that in the considerations about what gets made about COVID-19, that multidisciplinary approaches are now factored in. So, for example, what explains times when you suddenly have a spike, which is something about, you suddenly have a spike when everything was opened, and then, those spikes get controlled, or after reopening, there's delays. So there, it may not necessarily be a medical question, but more a sociological question as to what are these factors that actually, at what stage do people start, for example, not wearing masks after such a long time of, not seeing cases rise and stuff, which then explains why after a period of not wearing masks, suddenly you see spikes. That needs to be explained a lot more than just, a simple application of public health solutions.
Ongama, just a quick and final question. There's a moving 7-day average, and we must look at this against the backdrop of the slow rollout of the vaccine. And I like the fact that you're talking about consistency and a period of time that is sustainable given these challenges. So it's one thing moving us to alert level 3 and having a curfew that is then earlier. But then how do you make the decision, as you say, on how long it should last?
Absolutely. So that's where, for me, government should jealously guard the integrity of its own decisions from a policy-making point of view by ensuring that it's evidence-based. It was understandable last year when government took some policy decisions purely on the basis of precautions, purely on the basis of what would a reasonable state do faced with the circumstances. But after a year and plus of COVID-19, you expect a lot more decisions to be justified by hard evidence. And that hard evidence comes from, for example, we know that, yes, indeed, alcohol bans do save with the issue of trauma-related and accident-related spikes in hospital cases. So it helps in that regard. We know it's a matter of fact proven. And what else then is a policy action that gets taken, which is premised on hard data. That's where government's ability to take decisions which are justified can come.
And as you say, that flip-flopping, something that they will be judged hard on is the issue of the closure of schools. Thank you so much, political analyst Ongama Mtimka. So we just have to wait another 45 minutes so when President Cyril Ramaphosa addresses the nation, and see how often he'll say the words with immediate effect. Of course, many people just straining hard against whatever whispers they're hearing to just say there's some decisions he cannot afford to take. You've heard why political analyst Ongama Mtimka says that, saying there must be some policy certainty that is evidence-based.